Wow. This morning, we're joined by Dr. Dana Hawkinson from the University of Kansas Health System. Dr. Hawkinson, how can this happen?
Yeah, that's a great question. So we do understand we have very good documentation and peer-reviewed reports, especially things in like the New England Journal of Medicine. We do know that you can have detection of the virus, especially from the nasopharyngeal swab or the NP swab, for up to 42 days after illness. In addition, those detections can go up and down, meaning sometimes we may not be able to detect it, but if we check again, we can. But the big question and debate is, are you still infectious during that time period? From other very small studies, we understand that respiratory samples or upper respiratory samples, conceivably the same area you get the NP swab from, they haven't been able to culture any virus really after 8 or 10 days. But the fact that you can still detect it is really not surprising. The big issue we're really trying to work on is, are you still infectious during that time period? And just one more thing, in South Korea, there's been reports that people are reinfected or having symptoms again. On the very early reports, although they aren't published, they've tested 39 people, and they were cultured 6 that are final, and they weren't able to detect any new virus or any live or infectious virus. We're still waiting for the full medical report. So the fact that you can detect it at least up to 42 days, we understand that, and that shouldn't be too surprising to people.
Well, on that 42-day span, I've already had a viewer reach out to me to tell me that he had 6 positive tests so far. He's also in the healthcare industry, so I'm hoping to talk to him as well to hear about his experience. Doctor, the FDA has allowed more than 100 commercial coronavirus antibody tests on the market without a lot of review here. What can you tell someone who's looking to buy one of those? How is it legit? How do you know if it's a good investment? Talk about those antibody tests that are on the market.
Yeah, so there are a lot of companies looking to do good things and try to get information out to the people and the power for the people to get those types of testing done. We would ultimately like testing to be available for everybody, just as if you got an influenza test. For the antibody test, there are also really well-established laboratories who have good tests for other things, who have validated tests. Some of these other newer labs may absolutely have validated and really sensitive and specific tests, but I think it's only going to take time, and only time will tell if those antibody tests are adequate from any other specific lab. I think certainly staying with established laboratories is probably the first step, but as we move forward and the other labs are continuing to produce those tests, that's the only way we're going to find out how sensitive and specific they are. And that will go through comparisons of each other's labs. Again, making sure that if the antibody test is positive, then you really have had the disease. And then if it's negative, that you really haven't. So we just need to make sure that all of these results that you would get as an individual buying this lab is fully accurate. Yeah. And you would expect and hope that a lot of these laboratories would have done their due diligence in making those, getting that data, saying how sensitive and specific their tests are, but you just don't know. And I think it's just going to take one day at a time and getting all of the information as we have these tests for more and more time and more people get those tests.
Sure.
Doctor, on Sunday, the president said new predictions from a draft government report said by June 1st, cases will surge to 200,000 a day with 3,000 daily deaths. What do you think about this? I feel like we get new projections and predictions all the time.
Yeah, I mean, it sounds pretty grim. We don't want that. Nobody wants that. We have to balance all of these types of things like infections, hospitalizations, and death with getting the economy back, with people out moving about, getting back into public and society. Projections are projections, just like you said, absolutely. We have to continue to reinforce the message that once we do open back up and as we start to, it is going to continually be boiled down to individual responsibility. And if we can all do our own part to help protect getting the disease and spreading it to others in our vulnerable populations, that's what we need to be doing. We certainly have to look for our leaders for establishing guidelines to how to open up, but also our public health guidance to really help us understand how we can stop it. And it is going to fall down to personal responsibility. Not going out if you're sick, only going out if you need to. Washing your hands frequently, not touching your face, coughing into your elbow or your shirt, and certainly trying to wear a mask so that they can protect other people from you in case you have it but haven't had symptoms yet. And that's what we have to look forward to as we get more and more into the reopening phases.